Okay, we're back for our second video. So we wanted to talk a little bit about what the future is going to look like. Okay, so a lot of you guys had some questions as to how are things going to look in our future. The first question is, in 2021, will the virus be gone? Since we're only just a few months away from 2021, I'm going to say the virus is still going to be here in January. Our hope is that they will continue to be working on a vaccine or working on some kind of medication that will be able to treat. You know, kind of like if you have the flu, they have something called Tamiflu that helps reduce some of the symptoms and some of the things that you feel, so you don't get the flu for a longer period of time. It cuts down on how many days that you would have the flu. So we're hoping that they would create some kind of medication that will shorten it or not be so, make the virus be so serious. Okay. So, yeah, we're hoping that it's not going to go away forever. The flu doesn't go away, even though we have a vaccine for the flu, and even though we have Tamiflu, it doesn't go away. But we're hoping that it would not be as contagious or as much of a risk for all of us. Okay. When will we go back to school as normal? Boys and girls, we're hoping that that's soon, that this is what we want. You guys have been doing an amazing, amazing job coming in every day, wearing your mask, keeping your distance. I cannot tell you how proud the teachers, Mr. Conley, and myself are. You guys are really, really, you guys are just doing an amazing job, okay? So we're hoping that we will be back to normal, but it's probably not going to be maybe for a couple more months, okay? Um, Will we ever have to quarantine again? We're hoping not. We're hoping that we don't have to um, quarantine, meaning I think you're thinking maybe if we have to stay home again and do go to school virtually rather. There may be a day that might happen, maybe more towards the winter months. But for right now, we're doing a great job of being able to keep our school open, and we're going to keep it open as long as we possibly can. Um, Oh my gosh, you guys are so cute. Do you constantly have to wipe down the doorknobs? You know, we should always be wiping down things right now, especially as flu season's coming in as well. I think that this is a great practice that the school will probably continue, because so many people are touching it, right? And so there's so many germs that are on there. People sneezing, people coughing. There's so many germs that are on there just normally, not with coronavirus. So I think that that's a great thing that Miss Angie will do, and keep those doorknobs clean all the time. When I'm home and I'm cleaning my house normally, if I was normally just cleaning my bathroom, I always spray my handles. I always clean my doorknobs rather. I always clean my light switches, and I always clean the thing that flushes the toilet bowl, the little silver knob. That's always part of my routine when I'm cleaning. Okay. Um, can I play with my friends if they just had COVID? As long as your friend tests negative, okay, and nobody else is sick in their home, absolutely. We don't want to keep you guys separated. And your friends are probably missing you as well, okay? And you're missing, your friend's missing you and all of their friends. So as long as that person is no longer is symptom free and no longer testing positive, then absolutely you can play with your friends. It's good to be outside and not really be in an inside environment, okay? So especially now as we're getting closer to winter time. Can I play socially distance with my friends? Look, your parents make the ultimate decision, but there are a lot of things that you can still do, and be distant, okay? And be far apart from one another. So yeah, be creative. Be creative with one another, and you would still be able to play. Um, why is the coronavirus always in the news? Because right now it's still a hot topic. It's still something that we are dealing with in our country and other countries. Okay, um, there were I'm trying to think, 190 countries that have been affected by the coronavirus. So it's all around. Okay, so yeah, that's why it's in the news. It's constantly just talking about it. Let's see. Will we be able to go trick or treating? That's really up to your parents. That's a parent decision. It's requiring you having to be in maybe in large groups or a lot of people, touching people's doorbells, people giving you candy. What I'm going to say is that if you happen to go, you need to be very careful. Make sure your mask is on. Do not eat any candy while you're out trick or treating. Bring everything home and let your parents go through it all to know what's good, what's not good. Never eat anything, even before Corona, anything that is unwrapped or not sealed properly. Okay. So you want to just do that more so, okay? So that it's not, you don't want to take anything where you're grabbing into a basket, because remember, if you're grabbing into a basket to take a piece of candy, so are many other students or many other children that are coming to those houses. So it's all about being safe all the time, but specifically during coronavirus. So a vaccine. What is a vaccine? A vaccine is a medication that helps protect you against a certain disease. It kind of weakens the what they call the microbes, or the things that make up the virus. Okay, Mrs. Ford's not very scientific, but I did try to look up some of these answers for things that I didn't know. Okay, so it's some type of medication. Think about if you go get your flu vaccine, you get a little needle, okay, so they get a little shot in the arm, and it's to help to not get that type of virus. Is there a vaccine that's almost ready? Um, there's many stages and trials and things that you have to go through. It takes a long time to be able to create a vaccine. They say that it takes about 12 to 18 months. I know that some of our larger pharmaceutical companies have been working on it. And I know that some things maybe didn't work out the way they wanted to, so they kind of had to stop and start again. Think about, you're building something with blocks, right? And it gets to a point, it's like, this just isn't working. It's not going to be sturdy enough for me to continue. I need to backtrack a little bit, take down some blocks, and build a better foundation. And that's the same thing with the vaccine. They're working on different trials, but it's not working the way they want it to work. So they have to back it up a little bit and go back and relook at some of the things that they're working on, some of the scientific factors, and try to start again, okay, and continue working from there. Are children going to get vaccine? Well, that's up to your parents. Most parents get their kids vaccinated, but some parents are against vaccines. So it's really up to your parent, to your doctor, depending upon if you have any other medical conditions that maybe say, hey, it would be more beneficial, it would be better if you took the vaccine, or maybe you might have some other kind of medical condition, say, you know what, it will be too risky for you to be able to have that vaccine. All right, so good. Those were those questions. Fantastic, guys. School. If the coronavirus ends, will we keep the half-day schedule, or will we go back to our full day? We want to give you as much education as possible. So whenever we're able to go back to a full-time day safely, okay, absolutely, 100% we will. As soon as the Board of Health tells Dr. Caponegro that we can, as long as we're able to provide that, and again, as long as your parents are willing to send you back full-time, yes, we will. If someone gets coronavirus in the class, will the class go virtual? So we actually have that going on right now. One of our 4th grade classes is participating in school virtually for I believe it's for 2 weeks, and so we're able to do that versus having to close the whole entire school. There's some schools that might just close a whole entire grade. Okay, I believe that's happening in my town right now, that the whole entire grade is closed for 2 weeks because there are a couple people within that grade, and so that they were confined to just that grade level. Will we do a school play, or will it be canceled because of COVID? I can't answer that right now. Most of the time the school plays happen at the end of the year. So we'll have to see where things are. And if things are going great, then we might be able to start up some of our after school activities. Okay. Will we go back to virtual learning at some point? it all depends on where our numbers are. It all depends on, if the mayor, not the mayor, well, the mayor too, but if the governor says that we need to close our schools and go back to virtually. So everything, as time goes on and we see how the winter months go, will we be able to determine more whether we're able to continue and how we're doing right now, which we're doing an excellent job of being able to provide you with an education here in our school building. Okay. If my teacher gets coronavirus, what will happen? You may just have to quarantine. That class may just have to quarantine for that time. Why do we have to eat our snacks every other row if we have shields? Because we want to always take safety precautions. We want to make sure that we're always keeping you guys safe. So the more distance that we have and more separation that we have, the better that it will be. So family, if someone gets it in my family, should you quarantine in your room? I'm sorry, if I get it, should I quarantine in my room and not see my family members? That all depends upon people's ages. My neighbor's son just had it and he was older and he did stay inside his bedroom for the 2 weeks. Only allowed out to go to the bathroom. But again, you guys are younger. Mom and dad need to take care of you, grandma, whoever it is that you live with. So things might be a little bit different, okay? Could you see family members that are not in the high risk category? And again, it's all according to your parents. So if you have an aunt who might not be at high risk and might be a little bit younger, and mom and dad or your aunt feels comfortable visiting with you guys, it's all a personal choice, okay? How scared was I when I heard the news that it came to New Jersey? Well, of course I was nervous because we didn't know what it was. It was more the fear of the unknown and not knowing how this virus can interact than anything else. Did I get the virus? No, I did not. And oh my gosh, you're so adorable. I am okay, but I would like to know how are you doing during this time? I'm doing great because I know that we're keeping everyone safe and doing the best that we can, both here at school and both at my home. So thank you so much for asking that. Why does it affect younger people or older people more? Because they're more susceptible because of their age. They're apt to have more medical conditions as being elderly. So that's why it might affect older people more than it does younger people. Can kids get it? Sure, kids can get it, but usually most children who get it do not have the symptoms that are as severe as older people, okay? Or people in their late 30s or 40s or 50s. The last couple of questions are about cases. How many cases do we have in Florham Park? We currently have 202 cases in Florham Park. How many people died from coronavirus overall? 1,174,031. How many COVID cases have been total in all of the world? 44,482,501. And then how many cases are in New Jersey? And that is 232,997 cases. That was a lot. Boys and girls, you asked a tremendous amount of questions. I am so proud of you. I hope that this was helpful and informative for all of you. If you feel I didn't answer your question or you may have other questions, please feel free to email me again. I'll be more than happy to respond back to you guys. Stay safe, be smart, wear your mask, continually wash your hands, use hand sanitizer, especially before eating. Don't touch your face. And again, stay really safe this weekend if you guys are going out trick-or-treating. Have a wonderful day, boys and girls, and thank you again for all of your questions. Have a great day.